Hello and welcome to a new episode of Majlis podcast by Emirates Hospital Group. I'm Wael Berro, your host for today. I'm a family medicine consultant at Emirates Specialty Group. Today is a great honor to have my returning guest and my colleague at Emirates Group, Dr. Nathalie. Dr. Nathalie.
Hello, Dr. Berro. Thank you for hosting me a second time. Today is Lupus Awareness Day, or I should say it's Lupus Awareness Month, the month of May. So that's why we're meeting to talk about this disease. I'm Dr. Nathalie Chalhoub. I'm a consultant rheumatologist at Emirates Hospital Jumeirah. I completed my medical school at the American University of Beirut, and then I trained in internal medicine and in rheumatology in the United States and got my American board certifications in both internal medicine and rheumatology. During my training in rheumatology, I developed actually special interest in lupus as a disease, and I did additional research in that topic in particular. So I completed a Master of Science in Clinical and Translational Research, working more specifically on lupus.
Good. So there couldn't be any better person to talk to about lupus today. But let's start with basics. We hear of lupus, and I'll say it in Arabic, the zi'bi, I think, if I'm not mistaken.
Correct, the zo'ba.
And it's very interesting because it's a wide disease. So please tell us, let's start with basics. What is lupus and how does it present?
So lupus, I think not a lot of people know what the disease is. The actual terminology is systemic lupus erythematosus, SLE. And it's an autoimmune disease. So it's a chronic systemic autoimmune disease. And it's actually the best example to explain what autoimmunity is. So autoimmune disease meaning the body's immune system, which is the defense mechanism usually attacking viruses, bacteria, foreign bodies, in this case, starts attacking the body itself, like the healthy tissues, causing inflammation, which might lead to damage in various organs. And in lupus, this can happen in a lot of organs in the body. So lupus can affect different parts of the body, ranging from the skin, the joints, the heart, the lungs, the kidneys, the nervous system, the blood. So this autoimmune, reaction can happen to different parts of the body, and it's a systemic disease. That's why we call it systemic, because it affects different parts of the body.
And it's quite actually debilitating, unfortunately.
It could be. It depends on the severity of the illness. Some people present with mild symptoms like joint pain and skin manifestations, and others can come with more severe disease manifestations involving mostly internal organs like heart, lungs, and kidneys. And in those situations, it can definitely become more complex and more debilitating.
Now, then the next question, which is probably challenging, especially the unknown nature of autoimmune diseases. Who's at risk and why?
So it can affect anyone. That's to start with. But
to scare all our audience today, so we're all at risk.
Everybody gets scared. No, not really. I mean, some people are have a genetic predisposition to develop the disease. It's actually more common in women. The ratio of women to men is 9-1, so it's way more common in women. So we think there might be also a hormonal factor. People who have a family history of somebody who has lupus or other autoimmune diseases are at a higher risk than somebody who doesn't have anyone in the family. And then we always say somebody who has a genetic predisposition, and then there are some environmental factors that come and might trigger the disease in someone, not in other persons. So there is this combination of genetics and then environmental triggers.
And if you don't mind me asking, what sort of environmental triggers for our audience out there are the main ones?
So smoking is a big one. UV light in the case of lupus, because one of the main manifestations actually are skin rashes. So UV light can trigger the disease. Hormonal factors play a role, hence the disease being more common in women than men. Some kind of like silica dust, that we find sometimes in some forms of cleaning powders, and people who work in mining and stuff can, get exposed to some form of, silica dust that might trigger it. So the many factors, and sometimes even stressful life events, can trigger autoimmunity in somebody who's predisposed to having an autoimmune disorder.
Fair enough. So life, unfortunately, is a bit unfair and things happen, but you're here to help if needed and hopefully never. Now, I want to talk now to Nathalie, the person. So we're going to put all your degrees, all your experience. From your experience, though, as a doctor, I want to ask you about something personal, something that marked you as a doctor through your career, whether at AUB when you were a medical student or whether at your training in the States.
So during actually my medical school years, this was the time when I saw my first lupus patient. It was in my last year of training as a medical student. And we had a young woman who was admitted with like severe manifestations of lupus. She had lung bleed and seizures and was admitted in the ICU. And that really kind of marked me at the time, you know, to see somebody so young being so sick. And the disease was new to me in terms of, I didn't know much about lupus at the time. So it was very interesting, but at the same time very painful to see somebody suffering that much. And years after, I developed more interest in lupus as a disease. And during my training, I mean, I've come to meet a lot of very nice people, you know, who actually have the disease and are suffering a lot. And it's kind of hard to see this, you know, this dilemma in young women, young men who are trying to, you know, build a normal life, maintain a good quality of life, because it usually happens at young age. And at the same time being struck by such a debilitating disorder.
Thank you very much for sharing the story, Dr. Nathalie. Now, one of the difficulties in medicine, we always talk of prevention. I try always to push for early diagnosis. I'm assuming it's a bit hard to miss sometimes lupus, because if you don't think of it, we might miss the presentation and treat it for something else. How do we diagnose lupus? What are the symptoms that patients should flag or be aware of, that they go to the doctor saying, I might have lupus, I need to be tested? And how is that diagnosis done, please?
So it's not very easy to diagnose, because not all of the symptoms happen at once. So someone might have some symptoms, like vague symptoms first, like what we call constitutional symptoms of sometimes extreme fatigue, even fevers, weight loss, which might happen in other diseases. And then sometime after, even sometimes months or years after, develop some other, you know, symptoms. So it's kind of tricky sometimes to diagnose from the first time. But I mean, of course, people should know about the symptoms of the disease, so they watch for them. So we look for definitely skin rashes, sensitivity to the sunlight, that might end up, you know, with like big rashes on sun-exposed areas. Joint pain and the joint disease, arthritis, is one big thing. Like more than 90% of, you know, patients would develop joint disease at some point. And then in terms of when we're diagnosing, of course, we look for these obvious symptoms of skin and joint findings, but we also look for any internal organ involvement. So in some severe cases, patients might be complaining of like chest pain or shortness of breath if there is lung or heart disease, or also kidney disease can cause, you know, some changes in the urine or in the kidney function. So those are stuff we check for when the patient comes with a suspicion of lupus. So we would be looking mostly at the clinical features, but we would also be checking some routine testing to look, let's say, at their blood counts, to look at their kidney function, to look at their urine, make sure there is no blood or protein in the urine. And we also rely on some other blood tests that we use to support our diagnosis, including some what we call autoantibodies, such as the ANA, the famous ANA. So the ANA is a substance that the immune system is basically producing, but it's working against the body itself, hence the name anti-nuclear antibody. And then we check for it. It's positive in almost all patients with lupus, but not everybody with a positive ANA has lupus. But this, among other antibodies, are also used in order to support our diagnosis. But the main thing is basically the clinical features. And we have to take a full history, as I say, because somebody might have had symptoms maybe a few months back or a few years back. So we have to put the whole picture together.
Fair enough. And maybe this is kind of to highlight through today's episode the importance of talking to the right doctor rather than rushing and doing blood tests without really having someone who has examined you, because the false positives could cause a lot of unneeded and unwarranted anxiety.
Correct.
Now, despite your years of experience, you're quite young, but despite this as well, the treatment of lupus and treatment of autoimmune disease is evolving very quickly. What's new and what actually are we looking for now if someone's diagnosed with lupus?
So the treatments of autoimmune disease, as you mentioned, has evolved like really in a very fast way over the past few years. We still use some conventional treatments in lupus, and we have newer agents also. So a lot of patients with lupus might receive, steroids at some point, especially in the early phases of the disease when they come in with like severe symptoms. Some might even receive like high doses at first, like what we call pulse steroids through the veins, IV steroids. We try nowadays to minimize giving steroids as much as we can because we have also alternative medications. most patients, I should say maybe all patients with lupus should be on a medication called hydroxychloroquine. That's kind of a cornerstone treatment, baseline treatment that would help with arthritis, it would help with the skin rashes, would even help, in improving or decreasing, I should say, sometimes the risk of blood clot formation. So it has a lot of benefits, decreasing the frequency of having disease flares. Unless there is a contraindication, we always try to give this medication. A lot of patients do well, especially if they don't have like severe organ involvement, mostly skin and joints. And then if we have to add on other treatments, then we have more options at this point. We have what we call the conventional disease-modifying agents. Some of those come in the form of pills. And we also have nowadays more of the biologic therapies that are emerging, biologic-targeted therapies that can be used in the management of SLE, especially when we're talking about lupus nephritis, which is when it's involving the kidneys or other parts of the body.
Fair enough. Now, as part of any treatment, and I'm sure you do that, I want to talk about lifestyle changes because yes, the medications are evolving. They're amazing treatment. And you mentioned the biologics there that I think every time I blink, there's a new biologic coming. And it's hard for me as a family doctor to keep up to date, but not to you, of course. But what are the lifestyle? What do, as a patient, I have to do on my part besides trusting your care?
So the lifestyle, patients with lupus, we should say, are at increased risk of cardiovascular disease, of heart disease. The risk is pretty high. So in terms of diet, for example, the same type of diet that we advise for cardiac patients in terms of avoiding like fatty food, in terms of avoiding processed food, would apply also for patients with lupus. So having a healthy diet in terms of a variety of fruits, vegetables, whole grains, a healthy fat, that you find in olive oil, avocados, nuts, fish. So a variety of, fruits, vegetables, at the same time, moderate amounts of meat, poultry, and fish in terms of having a diverse diet and avoiding anything that would cause heart disease. Smoking is a big thing that has to be avoided and stopped if possible. We always advise, as this is one of the triggers that can trigger the disease in patients. Having good sleep, decreasing stress if possible. Exercise is a big thing to maintain mobility, especially in patients with arthritis, and also to improve cardiovascular health. I know it's hard sometimes for patients who suffer from joint pain to go and exercise, but we always say, start with the small steps and then you can build up more. And beyond that, it's really important also to know the triggers of lupus. So we know that the UV light triggers flares. So we advise all patients to wear sunscreen even if they're sitting indoors. And when I'm saying sunscreen is like 50 plus SPF in order to minimize skin flares and also other flares of disease. There are certain actually supplements that patients should be aware of to avoid. So a lot of people think of lupus being an immune problem. They think they should take immune boosters. It's actually quite the opposite. We should avoid immune boosters like garlic, or there are some supplements like alfalfa sprouts that you find in some of those supplements that are over the counter that can actually trigger lupus flares. I have a patient a few years ago who thought that garlic is a good thing for the immune system and just started eating garlic, and the next day she woke up with like a rash from head to toe. So there are certain stuff to avoid in terms of moderation when eating, in terms of what food to eat, what not to eat, and also be aware that some of what we think might be helpful for other conditions is actually not in the case of autoimmune diseases. Some antibiotics also, we actually inform some of our family doctors and primary care, like Bactrim, for example, is one of those antibiotics that can trigger flares in lupus patients. So we educate about our patients about that, and also other physicians.
Thank you very much. Actually, you are educating me again, like the first episode I had you here. So it's always feel like a medical student when I'm with a rheumatologist. Now, you mentioned exercise, because I was going to ask you about it, because it's interesting. People's complaint, especially when they come to us as the primary care physicians, they're in pain, they have stiff backs, and then the more they don't move, the more the pain. I guess pain management is a big part of kind of controlling the disease.
Correct. In the first phase, when somebody's complaining of a lot of joint pain, we're of course trying to treat with medications, especially if we have arthritis, like actual joint disease, not just what we call arthralgia, which is just the pain. So if we're treating with medications and the patient is improving in terms of like there is less inflammation in the joints, then they should start also incorporating some activity. we always say you don't have to start, doing 1 hour per day from the start, but at least to start with 10, 15 minutes of muscle strengthening type exercise in order to start building up a little bit of strength. And then it starts going, it starts improving with time. When we have difficulty with mobility or some patients are facing some difficulties in certain parts of their bodies, then physical therapy is a very important thing to add. Aquatherapy, like if people swim or even do some like exercises in water, that can help a lot also. And pain management, in a lot of cases, we have to collaborate with you as a family doctor and with pain doctors, in order to address this from a multidisciplinary approach, because not all of the pain is actually inflammation. We have a big number of lupus patients who also suffer from fibromyalgia. And there is this overlap. Is the pain related actually to inflammation in the joints, if it's still there, or are we actually dealing with some form of chronic pain or fibromyalgia pain, given the chronicity of the disease and the effect it has on people's, lifestyle? And it's life-changing, to carry such a burden of a chronic disease, and it can affect, how people react to it.
It sounds like an episode of Netflix now, where we're considering the next episode is going to be fibromyalgia, because I know many people would love to hear about fibromyalgia. It's a very complex condition, but we'll keep it as a teaser for now. Lupus is a chronic disease, which means we have to talk of long-term management plan. It's not about just take the treatment and then in 3 months, I wish you're better and you're gone. What is the role of patient education strategies? What is the role of the community surrounding them? Because, of course, it's a multidisciplinary team, which means it's not only us as healthcare providers, it's the family, it's the community around.
So education is a big thing. Patients, it's hard to, diagnose somebody with lupus, and it's hard for a patient to receive that diagnosis. It's not an easy disease to have, but nowadays we have treatments, and hopefully we will have more support, from the community. That's why we're talking today, because it's Awareness Month, so people know about this disease more. The reason patients should really understand the disease and what it can do is because they should be part of their actual treatment. They should understand that they have to come regularly to their appointments. At early signs of any new symptom, they should seek medical care and not let it drag. So recognizing early symptoms, understanding the complexity of the disease, maintaining, their regular follow-ups with the rheumatologist and the other doctors who are also collaborating in their care is very important. And it's also important not only to educate the patient, but also to educate the family members. Like this patient, if, as part of a community, whoever is living with them, whoever interacts with them should know about their disease, because those are people who are actually suffering in silence. The logo of the statement of the Lupus Foundation of America is make lupus visible. Because, if you see a lupus patient, you wouldn't recognize, there is nothing screaming to the face that this patient has lupus. But they might be in pain, they might have kidney disease, they might have very complex issues going on, and it's hard to be dealing with this alone. So educating the patient, educating the community, so there would be collaboration, there would be support from other members too.
I really like this logo actually, so I might actually borrow it for other conditions. I'll say the word borrow it, not more. Dr. Nathalie, it's really a pleasure always having you here, and I'm not sure if it's appropriate to say Happy Lupus Day, but thank you for raising the awareness. Thank you for talking about this topic. And I know from our shared patients that have been receiving care under your expertise, they're very happy. And thank you very much for doing the job you're doing. Any take-home message now for people who are diagnosed with lupus or just now or been living with lupus for a long time?
So for people living with lupus, as I mentioned earlier, it's always important to recognize, early signs of new symptoms. Something new comes up, it's important to seek care. Follow with your rheumatologist on regular basis. Comply with taking the medications, because they make a whole lot of difference in terms of, management of the disease and maintaining, disease control, decreasing disease activity, avoiding organ damage. And then last, I would say prioritize, self-care. Learn about your disease, get support from your community, educate your family members about what you're going through, and prioritize self-care. That's the main thing I would say.
This brings our today's episode to an end. Thank you very much for listening. Please stay tuned for a new episode of Majlis podcast by Emirates Hospital Group. Dr. Nathalie, thank you again.
Thank you, Dr. Berro, for hosting me.